I do have one little game that I like to play with you, and I played with my other plastic surgeon friend. I've actually had 2 cosmetic operations on my face. We played Guess the Operation. Would you like to play?
Yes.
All right. Your glasses are coming off.
Okay.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
Hello, and I'm Dr. Jay Feldman, and welcome to the Specialty Collective, where we bring in specialists from all over the country to talk about what their field is really like. Today, we have the honor of having Dr. Joel Kopelman with us. He is an oculoplastic surgeon based out of New York City. This guy has written courses on facial plastic surgery. He's been in the business for 35 years, and he knows everything there is to know. So, say hello to Dr. Joel Kopelman.
Thank you for having me as a guest. Happy to be here. As you know, I'm an oculoplastic facial plastic surgeon, and I've been doing it for 35 years, and I enjoy every day of practice.
Yeah, well, thank you so much for joining me. I'm sure everyone is super pumped to learn about plastic surgery. It's usually one of the hot button specialties that people like to talk about, especially in medical school and before. I actually was encouraged to be a plastic surgeon by my grandmother and my mother. Just wanted me to be a plastic surgeon with no idea what it meant. They just wanted to call their grandson a plastic surgeon, I think.
Okay.
But let's talk a little bit about plastic surgery. Talk to us in a very general sense. What is plastic surgery? What do you guys do?
I like to think I make people happy. I like to think that I try to put people back together if there's anything broken, and that could mean some kind of facial deformity or some kind of injury sometimes, but also people who have age-related changes, and it makes them feel great to feel younger, more vibrant. And sometimes their face does not reflect their true inner youth. Sometimes their exterior is aging faster than their psyche ages, so to speak. So as a result, I'm happy to be a vehicle for them to improve their lives and make them lives more gratifying.
Yeah, it's an awesome answer. Thank you. Going on, like I said, this is one of the hot button specialties. A lot of people going into medical school think they're going to be plastic surgeons, want to be plastic surgeons. What is the training really like? What kind of routes can you take to become a plastic surgeon, and how long do they take?
Let's just backtrack for a minute, because I think a lot of specialty people desire to go into certain specialties based on the kind of monetary reward they think they're going to get. I think that's all wrong. You have to have a enthusiasm and a certain personality to want to go into plastic surgery. But I think it's just like a Rorschach test, where people really pick something based on some particular personality trait or some kind of interest that they have. I know there's proctology and then there's plastic surgery, but when people say I want to be a plastic surgeon, they're thinking, well, they're going to all live in a mansion and ride in a Bentley. I think you have to go for a specialty that you have a passion for, and then there's something intrinsic about your personality that's led you there. When I was a teenager, I used to paint, and I had an artistic or oriented brain, I believe. As a result, I believe I ended up in the right place, okay?
Yeah, it's so important for people to know, especially when choosing a specialty. And I've done a separate video on this, on if you end up in a specialty just because you were pressured into it, your father was, you're looking for a certain lifestyle or salary, you're probably not gonna end up happy. And you might not even make so much money if you're not loving what you're doing. I chose family medicine, and a lot of people question it because of my board scores and everything else that I've done. But I know what I want to do. I see I have a vision for myself in the future. So it's very important. You had a calling, you knew, and it was just the right fit.
Right. I have my own operating room, which is my playground, and I don't feel like it's a job that's forced to do. I love what I do. I love helping people. That's who I am.
It's awesome. So for those people who do feel the calling for plastic surgery, maybe their personality fits and they're gonna make that, pull the trigger and actually do it, what does it take to get there?
Well, it's many years of being committed to long residency and fellowship training. In my case, I did an internship, then I did a residency for 3 years, and then I did 3 fellowships following that to arrive at what I do today. So it's many years of commitment to doing what you ultimately want to do, and you have to set your goal to doing that. In general plastic surgery, it's 4 or 5 years of commitment at least, and then in dermatology they also do cosmetic work, which maybe include lasers and other treatments, maybe not as much surgery, but they also have a long trajectory from the time they're starting undergrad as a pre-med to medical school and so forth. So it's a long commitment. It's worth it in the end, but you have to be prepared to be in school, so to speak, for a long period of time.
Yeah, absolutely.
And you don't earn that much, obviously, as a resident or fellow, but if you love what you do, it's worth it in the end.
Yeah, absolutely. And for a lot of the viewers out there who are interested in actually pursuing a plastic surgery residency or fellowship after ENT or ophthalmology, whatever it may be, there's a couple of, direct roads to being a plastic surgeon. You can do a plastic surgery residency, which is, I believe, 5 or 6 years, but a lot of people cannot get into that residency. A pretty common, strategy to get into plastics is to go through general surgery, which is 5 years of general surgery, and then I think it's 2 to 3 years of plastics, plus or minus whatever fellowships they might do.
Right.
So by the time you finish,
You're 40.
you're 40.
Right.
So that's like a major life decision that a lot of people actually need to take into deep consideration.
Yes, especially since there is a lot of medical students who are in deep debt, financial debt, and it's very hard for them to stay in these residency and fellowship programs for so many years because their debt is mounting, and by the time they come out, they're really poor, and then they have to, try to play catch up to try to pay for the debt. But unfortunately, it's very difficult, and there's a lot of competition now because of all these different specialties like oculoplastics and facial plastics and dermatology and general plastic surgery. They're all converging in the same location to the same type of patient who wants to have cosmetic treatments. So it's very competitive, and you have to really be on your game in order to succeed.
Absolutely. I walk down the street in Manhattan in Midtown, and you just look, plastic surgeon, ENT plastic surgeon.
They say if a brick falls out of the building, you hit them on the head walking down Park Avenue. So there's so many plastic surgeons walking up and down the street. So, obviously there's a need. It's become more acceptable also. I think what's happened in the last 20 years is that because of Instagram and Facebook and YouTube and the Kardashians, and it's become much more acceptable to have plastic surgery. In the past, people would hide and pretend they never had plastic surgery, or at least on the East Coast. On the West Coast, where I trained, it was almost a badge of honor to have plastic surgery. Every other person had plastic surgery.
Yeah.
On the East Coast, it's still a little more conservative than the West Coast, but it's becoming more acceptable, and it's nothing that's considered shame to have cosmetic surgery.
Yeah, and I can attest to that. My generation, there is no taboo whatsoever for having some plastic surgery or non-invasive cosmetic procedures. It's very mainstream. So tell me a little bit about what your day-to-day is like now as an established practicing plastic surgeon.
So every day is different, and that's what makes my practice fascinating and interesting. First of all, every cosmetic patient has a different array of issues. Whether, when I look at somebody's face, I look at their shape of their face, the architecture of their face, their skin, they have aging changes, that there's volume issues. There's a lot of things that go into the analysis. So every patient has something unique about them, and you have to break down the problems into pieces and then try to come up with a plan that makes sense for the patient. Do they have the time to have the surgery? Do they have the time to recover? Do they have the finances to pay for the operating room and the staff and my fees? So all those things have to be taken into account. And very often it's difficult, it's challenging, because there are people who are professionals who don't have the time to recover or go through these procedures, or maybe they're averse to having surgery. So that's why the non-invasive procedures have become so much more popular. The Botoxes and the injectable fillers have become very much part of cosmetic facial practices because people would like the instantaneous gratification from getting these treatments, number one. Number two, they're very safe. And number three, they're not as expensive as undergoing an operation. Sometimes we combine these two different areas, so to speak, the non-invasive with the invasive procedures, to get a kind of a composite improvement on the patient. So some patients will have a facelift, but they also might need some injectables as well, Botox or fillers, in addition to their facelift as a added treatment to get the best possible result in the end.
Yeah, it seems like a pretty well-rounded specialty in terms of the things you spend your time doing.
Yes.
Which is what keeps it interesting and fun.
Absolutely fascinating. I can see one day people with serious facial cancers that I might have to do reconstruction on, or the next day I might see somebody who just wants to have their lips plumped, and and that's okay. The variety makes my practice interesting and challenging, and it keeps me on my toes because I have to constantly think about different ways of treating the patient to get the best result.
Yeah, absolutely. So what is your lifestyle like? How many hours are you in the clinic each week? How many operations do you do? How many weeks?
Well, first of all, I don't consider my office a clinic.
Yeah.
I consider it a boutique.
Boutique.
Okay, so we treat everybody as a very special individual. I work approximately 5 days a week. Some weeks in the summer I cut back a little bit to go to the beach, but otherwise I'm here 5 days a week, and then I operate twice a week in my operating room, and I have a state-approved operating room. I have the freedom to schedule these cases whenever I want. I really have a lot of freedom to do what I want in comparison to a lot of physicians, unfortunately, who have to work for the hospital systems where they're compelled to do things according to the hospital rules and regulations and so forth, which limit their ability to do creative things as well. If you work for a hospital system, they may tell you you don't have that much time to spend with any individual patient. You have to keep moving to see as many people as possible.
Yeah.
In my case, I have the luxury to spend time and energy with one patient, like I'm painting a perfect masterpiece. As a result, I get greater gratification ultimately in the end.
That's a little bit more fun of questions.
Yeah.
This might be a tough one, but if you had to pick one other field other than plastic surgery is off the table.
Oh.
I'm going to take ophthalmology off the table too.
Okay, so that's difficult. Believe it or not, like hand surgery. Sometimes doing urologic surgery also in kids would be interesting. I think anything that has to do with minutia and a lot of details, I don't know, but I think that's basically what I would have chosen possibly as an alternative to oculoplastics. A lot of people go to work every day and they don't enjoy what they do, but I do.
They're very fortunate. And I've seen the anatomy around the eye and the hand, and that terrifies me. So God bless you.
Yeah, well, I to me, it's all fun. I mean, it's
You like the challenge.
It's nothing scary to me though.
So one more. Tell me a stereotype or a misconception that you think the general public has about plastic surgeons.
Yeah, well, I think that they all think they're billionaires riding around in Bentleys. That's a total misconception. There are many successful plastic surgeons who lead very flashy lives, especially on Netflix. In general, there are many successful plastic surgeons, but there are many who have very average practices who can't compete because either the results are not great or they're just not that personality for the job, so to speak. But I think that also social media has had an impact on practices. Most of us are nerds and we are not that familiar with talking in front of a camera or going on Instagram or on YouTube. But younger generation of plastic surgeons coming out, they are imbued with social media and they're very comfortable with it. So I think that that's impacted practices significantly. I think that it's good to communicate with people. I think it's good to open up, take away the mystique of plastic surgery. I don't want to minimize plastic surgery. It's serious stuff. You know, when you decide you're going to have an operation, it's an operation. I think that it's good to kind of dispel a lot of mystique and fear and so forth from the patient, and that's why I'm talking to you today.
Well, thank you for joining me. I do have one little game that I like to play with you, and I played with my other plastic surgeon friend. I've actually had 2 cosmetic operations on my face. One of them was because of an injury, but we played Guess the Operation. Would you like to play?
Yes.
Okay. Your glasses are coming off.
Okay. I think you had your nose done.
I did.
Okay.
There's still a little remnant of a scar. When I was young,
Yeah.
I went off a ramp on a bike, came off, and the bike smashed me in the face, and just really destroyed my nose.
Oh.
And
they did a good job.
Thank you. Yeah, you can see it's.
Yeah.
They did good work.
Very nice. Very nice. I can hardly see any incision.
Yeah,
That's
I'll give you a freebie on the next one. When I was 10 years old, I used to look like this with my ears sticking out.
Oh, yeah.
So I had my ears pinned back as a kid.
Oh.
My mom actually talked me into it, but it was
Great.
There's still some scars back there.
Great. Yeah. Oh, yeah. I see it. Very nice.
Yeah.
Good job.
Thank you.
They did a nice job. Because it's nothing I jumped out and looked at or recognized.
I wasn't born like this. This is all fake.
Well, you look great.
Thank you. And Dr. Kaufman, thank you so much for joining me.
Thank
It's a
you.
pleasure to have you on the show.
Thank you.
Again, this is the Specialty Collective. If you want to follow me, I'm on Instagram, Dr. J. Feldman. And if you want to find this guy, he's also on Instagram. It's at Dr. Koppelman. and I'll put a link in the bio. And if you're ever in New York City, need some facial plastic surgery or non-invasive surgery, this is the guy.
Thanks.
Thanks again.
Thanks for the opportunity.